This is a deeper dive follow-up to my video on the new Botox face. The new Botox face was a video that I encourage you to watch. Essentially what this video argued was that people that get Botox long-term have a good and a bad. The good is that there's ongoing improvement in the skin quality, pores, texture, tone, the wrinkles that were originally there start to dissipate. The bad is that that upper face can start to look imbalanced when you compare it to the lower face, neck, chest area, the other areas of sun exposure. So that doesn't look good. And a lot of people that are very worried about looking fake, they don't understand that this is actually one of the reasons people look fake. So one of the reasons people think they look fake is that you see these overfilled results, which I don't do, or these overlifted results. That's classically what we think about when someone looks fake. But another reason people look fake is that the upper face doesn't match the lower face, neck, and chest from a skin perspective. One caveat I want to explain, and I've talked about it in another video recently about sort of dividing the aging of the face into multiple categories, is that the aging of the face is really divided into skin, volume, and gravity. So don't confuse when I talk about MesoBotox, MicroBotox, or even Botox that somehow there's a lifting potential. The Botox that lifts the brows up a little bit only lasts a couple months. So what we're talking about is not elevation of tissue. We're talking about improving the quality of skin so that you look a lot better. So we're going to do a deeper dive into MesoBotox and have you understand more about what this is. And that's, again, dilute Botox placed into the lower face, neck, and chest in order to balance the upper face. So we'll talk about when do we do it, what does it mean, how do we do it, how long does it last, what is the recovery, all those things that you need to know. So the first is, when should you start doing it? So I love to start everyone on it. My wife is doing it every few months because I think it looks amazing on her. It's changed the way her collagen looks, the structure of her face, the pores, texture, tone. She's got more compliments from that than anything else I've done for her. But if someone comes in, they've got a more limited budget, then I start with the low-hanging fruit, I call it, which is the upper face, because this is usually where the most damage is because of movement, where you see deep wrinkles, and someone says, look, hey, I don't even understand all this stuff, this sounds way too advanced. So my first timers coming in, they've never had Botox, or Botox naive is the way that we refer to it. I just start them on regular Botox, because I want them to do something that's not too expensive, easy recovery, easy treatment, that they just think it looks good. Who is the person that I'm telling to do this? So they've got either a lot of sun damage, or they just have been doing Botox for years and they're starting to have that little disparity or discrepancy between their upper third of their face and their lower 2/3 of the face and their neck. What does the word MesoBotox even mean? So the word meso, some people call it meso, but I like the word to pronounce it meso. So the word meso is from Greek, it means middle. And so it is the older term for the mesodermis. We now just call it dermis. And the dermis is the middle layer of skin. So there's epidermis, dermis, and subcutaneous fat. So that's the three layers of the skin in an abbreviated fashion. Of course, the dermis is then subdivided into papillary, reticular. We don't need to get into all that. But that middle layer, mesodermis, was treated in the past, and still is, but much more popular in Europe, using something called mesotherapy. It's a French term, mesotherapia, or mesotherapy. I think I probably said it with a Spanish accent. Who knows? I'm studying Spanish now, so I apologize. Anyways, mesotherapy. Okay, forget it. I'm not even trying to pronounce some fancy foreign words. But basically, mesotherapy is used to treat the middle layer of skin. And how did the French people do it? They basically, since the 1920s, have been injecting nutrients to help heal the skin. MesoBotox is the same thing. It's used to heal the skin. So a lot of people think Botox is a poison, and it absolutely is an amazing healing agent. I always say to my patients, I've said this probably 10,000 times, Botox is the most powerful healing agent on the face that exists. And we'll go into a little bit deeper what that healing is to the skin and the long-term effects of healing, etc. And so we'll do a deeper dive in that in a moment. So MesoBotox simply means placing Botox at the mesodermal level, or at the dermal level, to improve quality of skin. And so it's a form, if you will, of mesotherapy. It's just not using nutrients, it's using Botox to make that improvement. In terms of another word that is called MicroBotox, because it's small dilute amounts placed into the dermis to make this change. Why haven't you heard about this? That's probably a question that's burning in your mind. Why doesn't my doctor not even know anything about it? Why has he not offered this to me? There's several reasons why. The first is I'm obsessive learner. I'm constantly going to meetings, learning. I learned this from a guy in Pennsylvania. I don't even know if he does a lot of these, because when he presented his photos, it wasn't even his own photos. And this was like maybe 10 years ago. And I was in a meeting and I heard 60 lectures and I said, this is the gold one. And as I developed my evolution of thinking of this, I've gone through a lot of stages. So if you may have heard some older videos where I talked about this, I had a different philosophy, but as I've done it for now 8 to 10 years, I've evolved my thinking of what is it good for, what is it not good for. So I want to give you sort of a 2023 updated understanding of the power of MesoBotox. So where did he get it? I don't know, but there's a guy in Singapore that's really pioneered a lot of this, Wolfels Wu. And I was on a sort of a podcast with him back about 3 years ago, listening to his ideas, my ideas, and it was a really good exchange. So I think this is a little bit more popular in Asia. It is not something as popular in America. I don't think most people know about it, but it's such an insanely powerful weapon that beats, in my opinion, lasers or almost anything else, which is going to be a question you may have. I'm working on an updated page for my website that goes into this in more detail. So anyways, that's a very initial overview of MesoBotox. So I use it for face, neck, and chest. The treatment is then, how do you do it? Okay, how long does it last? What are the recovery and all that? So I'm going to divide it into face separately from neck and chest. So those are two categories. Each of those have a different type of recovery, a different type of results. And that way you can sort of decide which would make sense to you from budgeting one or the other, or deciding which makes sense to you. So with the face treatment, I use a numbing cream usually. It's slight discomfort still. My normal Botox, if you've never had my Botox up here, you'll be blown away, because no numbing cream, you won't even feel it because my hands are really good. I can't do that level of shaking in the face because it's got to be precisely placed in a 2 to 3 millimeter gap right in the dermis repeatedly, so that I get the optimal results with very minimal side effects. So, and that has to be done like 50 times a side. And so that's why there's slight discomfort with it, but the numbing cream really helps. And I'm done in about 5 minutes. So it's very, very quick and it's not bad, but there's a slight discomfort with it. Recovery-wise, in terms of bruising, there's typically very little. There can be some bruising, but if you understand where the architecture of blood vessels are, the blood vessels sit below the skin in the subcutaneous fat layer. So I'm placing this all intradermally. So there are very, very few blood vessels at the dermal level that are prominent. There may be some small ones, so there could be a little light discoloration of the little tiny bruise that's typically gone in a few days. There is a great makeup product my wife found, actually called Dermacol. I have no financial affiliation with these companies. It's like 20 or 30 bucks on Amazon. Wonderful product in terms of treatment for any mild bruising. I think it's a great one. I think it's spelled D-E-R-M-A-C-O-L. So I tell my patients to go buy that in advance of any facial treatments that I may be doing. But basically, that's the gist of the treatment. In terms of when do you start seeing the results, it's usually pretty quick. Within 2 to 6 weeks, you start to see your pores, textures, tones start to improve. We'll go a little bit deeper in terms of what are the aesthetic gains with this and how long it lasts in a moment. Talking more about the experience of the treatment and the recovery. So there's a very limited recovery on the face. The one negative that I absolutely have to emphasize is the smile. It can be, not always, can be a little bit tighter for the first 4 to 6 weeks. I've had a couple patients last 8 weeks and a couple patients last 3 months. The biggest thing, if you say, well, then I can't do that. When can I do this? Well, when you're not taking a professional photograph where your smile has to be exceedingly large, or you're getting married, or you got to be in a wedding party, or whatever it may be. Okay, so don't do it then. But I won a major award, a Lifetime Achievement Award last year in hair. I did my wife right before it because it's not that obvious if you understand it. You say, well, come on, I've had it done. It's a little tighter. Yes. But it's understanding that is something, it's a short-term punishment, I say, for an amazing long-term gain. Again, we're going to go into longevity and results in a moment. I'm just trying to focus and compartmentalize this to thinking about the nature of the treatment and the recovery. So recovery is very minimal, except for the fact the smile is a little tighter. And you say, well, what does that look like? So basically it looks like this. Best I can emulate this, it looks like this. So you see, this is a big full smile. You may not be able to do that fully for about 4 to 6 weeks. You need to, now, not everyone has that. Some people don't complain of it all, some people complain of it more. But I always say the difference between an education and an excuse. An education, I explain it to you, excuse is that, hey, why did you not tell me this, Dr. Lamb? You must have messed up and screwed up and this is not right. But it is something you just need to know. The benefit is that with the face, the results are very quick. Oftentimes after one treatment, you will start to see an improvement. I had a lady recently in her early 40s that said, I asked her, hey, do you see an improvement after one round? And she said, no, but I've had 5 compliments about my skin. So women in particular are very left brain. They're always looking, did it get rid of every pore? Did it get rid of these 2 dots here? I thought it was going to manage this. It didn't do that. So understand that it's not going to do all that. It should just make you look better, almost like you had the ultimate facial, the ultimate laser, whatever it may be. And again, we're going to dive deeper into the actual results and longevity in a moment. But this is just to overview the treatment and the recovery. So let's talk about the neck separately. So the neck and chest, I go all the way into the décolleté. I think a lot of women, even young women, are bothered by the fact that they get these vertical wrinkles in their breast tissue when they wear something down the décolleté. When they squeeze this area, they can see sort of these lines. They associate that with aging, so they don't like that. So I treat the whole sun-exposed décolleté zone. Now, I have never treated whole arms and bodies and stuff like that. I assume that you can do that. I don't know what level of Botox, in people with cerebral palsy and that with very tight necks, they're putting 4 or 5 bottles in. I'm not using that much, but I don't think my hands have the energy to inject your whole body, I'll be honest with you. So I've never done that. If you come in wanting that, I probably will tell you no. So I just do neck and chest, and I do all my own injections myself because the level of precision is very, very high. It's funny, my staff member Joy said, oh, I can do that, Dr. Lam. I said, I don't think you can. You don't understand. This has got to be placed in a window of 2 millimeters to be accurate, and you got to do that 50 times in 30 seconds. I used to teach fillers 20 years ago to doctors, and my God, people's hands are absolutely atrocious. People, they what looks easy to me, once I give you the instrument, you're going to freak out. You can't do it. So I will tell you, this is not hard. I'm a surgeon, a facial surgeon, but I will tell you, the first time any doctor is trying to do this, they're not going to place it right. If you place it all deep, you're going to really mess up the smile. You're really not going to get the dermal effect. So it's got to be placed exactly, perfectly, 50 times per side, quickly. Otherwise, you'll be there for 2 hours. I'm done in 5 minutes. So it is easy for me. It's not a deep plane, deep neck facelift that takes me 4, 5, 6 hours to do, but it is a skill set to learn. I've done it for close to a decade, so I'm very, very good at this. Now, let's talk about the neck in terms of the treatment and the recovery. So the neck and chest area, it is an area that, in terms of recovery, can have a little bit more bruising. It's not big black and blue, but there can be a little bit more obvious blue dots that may stay for a little over a week. Now, why is that? Because remember I told you that the blood supply comes out from below the dermis. Well, the dermis in the neck is incredibly thin. So even as I'm placing it there repeatedly, occasionally I may go a little deeper, and you're going to have a little bit of expression of that area. So just expect a little bit more bruising for a week. So obviously in the décolleté neck area, just for a female, for guys, they don't care about it as much. Just wear a normal shirt. The bruising in the neck, you may have to wear a scarf, or just understand you can have a little bit of discoloration, or use the dermacol to cover it. In terms of smile issues, all that, no, you're not going to have anything like that at all. In terms of results, I want to talk about a comparison of the results first before I go into deeper dive of the results. So in terms of when do you see the results? With the face, I typically see results much faster. Oftentimes with one treatment, I've already seen improvement. With the neck and chest, oftentimes it takes a couple rounds before you start seeing a more sizable difference. And the reason why is there's just not as many sebaceous glands in the neck and chest, so it takes a little bit more work to get there. And so just keep that in mind. Don't be disappointed if in one round you haven't got everything you wanted. And everything I do gets better and better. Okay, so let's now talk about longevity of the results. Let's talk about what we're seeing after 1 round, 2 rounds, and then let's do a really deep dive in terms of the aesthetic gains and goals, and then alternatives. So, and then supplementary therapies. So first of all, the great thing with this is that it really lasts. How long does it last? In my opinion, after you've built it a few times, it can last years. Believe it or not, it's the same with your normal Botox. There's no way, Dr. Lam, you're totally not understanding what I'm doing. Because women in particular look, they go, the line didn't go away. I can barely even see it. What they don't see is that their skin looks amazing. If you're a Botox user, frequent Botox user, and you're looking at your upper face and you're going, God, I still got a line left, take a step back and look at it. If you've been doing Botox for a few years by a decent qualified injector, you should start seeing that your pores, texture, tone, discoloration, quality of skin in your forehead looks substantially better than the rest of your face, especially if you've got sizable damage to the lower face. If you stop Botox up here 3 to 4 years, you probably will still look better in your forehead compared to your lower face. So that's the one thing I want to emphasize to you, is that this is a long-term improvement. I've seen patients, even after a couple years of not doing this, their pores, texture, tone, quality of skin still looks better. So durability-wise, I think is incredibly powerful. If someone's got a budget, they do it every 3 months for 3 to 5 rounds. If they don't have a budget, do it every 6 months for a few rounds. But once we start building it, you don't need to come in that often. I've had patients that don't do it for years and they still look better because there is a deep collagen healing. And I'm going to talk about what that is. I'm first now talking about longevity, and that's the thing. People have this absolutely wrong notion about Botox. They think, oh, it's good for 3 months and it goes away because a little wrinkle came back. What they don't see is profound collagen restructure, healing, and that's what I'm delivering, and that's incredibly durable. So longevity-wise, I think it can last years. The best way to get it to last a long time is to build a few rounds to build it. It's the same thing I say about up here. And so that's the first thing. Now let's talk about sort of what are the goals? What are we delivering on these kind of treatments? So things that I see with improvements are as follows. So first is that, number one, very quick, pores, texture, tone, quality of skin looks so much better. And that can be very, very quick. I had a story of a gentleman that had a scar on his nose from Mohs surgery. Did his deep plane facelift. He had little pores over there. And those areas actually within 1 round got really good. He says, what else can you do? I said, I can do your whole face. And his whole face, he had like 5 people say, you must have had a laser. You look so good. He goes, I did not have a laser, didn't want to reveal I had Botox. But that is, it's incredible. After 1 or 2 rounds, the skin starts to look good. And I always encourage patients, use your right brain to see the face. What I mean by that is when you use your left brain, you go, my left and right don't look the same. They didn't get rid of these 2 spots. This didn't get better. But when someone sees you, you say, wow, you look great. So that's the power of this. It's a profound collagen restructuring from pores, texture, tone, quality of skin, even mild scarring, some mild acne scarring, mild texture issues, discoloration, rosacea. You say, well, wait a second, did you talk about melasma, discoloration? Are you talking about changing color? If you get long-term Botox, look at your forehead compared to the rest of the face from a color perspective. You'll see that the color in the forehead looks substantially better than the rest of the face. So yes, color, but I want you to understand with color is that after 1 treatment, it's not like it just wipes out all the color, and that's the color takes the longest. I had a lady recently that I did about 3 or 5 rounds on, and after about 2 to 3 rounds over the summertime, she gets this melasma flush. She didn't even flush with melasma anymore. So I want you to understand, I'm not saying it's going to get rid of melasma. Do not hear me wrong. And it's certainly melasma and discolorations don't happen with 1 shot. Rosacea doesn't disappear with 1 shot. But in terms of long-term, amazingly so. Yes, over time, things get better and better and better and better. That's one thing so cool about this, and I'm very passionate about it. To me, it's a composite therapy when I'm looking at facelifts, eyelid surgeries, fillers, whatever it may be. It's amazing. What does this in the face really not treat well? So this is the evolution I was referring to. When I first started this, the reason I did this was not for pores, texture, tone. It was to manage what I call grade 3 wrinkles. Someone's smiling, they have wrinkles going down their face. I thought that was going to be the golden ticket. But I was a little disappointed. It did not really knock out these wrinkles durably on a long end, but it got some improvement. Those that were very religious got better improvement, but it didn't knock it out. But in 2 things happened. One is I started to realize, okay, it didn't knock out all those wrinkles, but my God, the skin looks great. So then last year I started doing this thing I call dynamic fillers. I learned this from a Dutch doctor where I'm actually cross-hatching these wrinkles and I'm getting instant approval of these deep wrinkles. So that way these flawless foreheads don't start not match these wrinkles on the face. I'm able to get a match now from a wrinkle, which is a dynamic problem using fillers, and a static using MesoBotox for pores, texture, tone, quality skin. So I'm going to repeat that because it's such an important point to understand it. To get the mid-face to match the forehead, you want to segregate that into 2 components. The MesoBotox or MicroBotox is managing pores, texture, tone, collagen, quality of skin. Not so much dynamic wrinkles, which is what I originally started all these therapies for years ago. But the dynamic fillers are now almost instantly managing these problems, and these are durable as well. These are not, people think fillers, if you Google fillers, Restylane or whatever, it only lasts, I use Restylane, Silk, lasts only 6 to 12 months. False. When these things start to build, everything starts to last years. Okay, so this is a false understanding that somehow fillers will only last a short time. Botox only lasts a short time. These are long-term durable results. Now, in the neck and chest area, as I told you, it takes a little longer to see the results, but the results are very comparable in terms of pores, texture, tone, quality of skin, all those things. But I want to emphasize something I've already said before. It is not going to help with gravity. It's not going to somehow lift your neck up. So if you're doing it for neck, décolleté, sag, no. Is it better than Ulthera, Thermage? Dear God, yes. If you really want to get nothing out of your neck and chest skin, please do Thermage and Ulthera. If you want to be blown away with the difference, go get those treatments first, waste all your money, and then come over here and let me blow your mind out of your mind, okay? Because what my therapy does is actually real. So I'm very convinced of this. If you can hear the passion in my voice, I'm not here just to sell you a treatment that doesn't work. I'm going to deliver on it. You said, well, why are there alternatives? What if I don't want this, doc? Could you do a laser for me? Absolutely no. I'm going to explain to you why. So do I do lasers? Absolutely yes. But there are a lot of things that this does on a deep molecular level that a laser cannot do. So let's talk about some of those. First of all, if I do laser for melasma, sometimes actually it exacerbates it. It definitely is not going to get all the pores and texture the level what my Botox can do. And the other problem is, what if you've got a type 4, 5, 6 or 5, 6. I just recently had an African-American lady that had gone over to Korea, got a laser, and she got burn injuries on her skin. I would never do a laser on a type 5, 6 Fitzpatrick. It doesn't make sense. It's too risky. I can easily do this for her. I could do this for anyone, dark skin. And so that's the first thing. It's safe in Fitzpatrick 1s through 6s. And if you're dealing with a laser, you're only safe up to 3 and 4. You can do some of them, but then you can have risk of hyperpigmentation and problems. So that's the first level. The second thing is that lasers don't provide molecular healing. You say, well, of course it does. It creates some collagen remodeling. Yes. But the process of rosacea development, the process of melasma development, the process of acne. You said, well, acne? You're talking about this will help acne? Yeah, I have a lady on my website where I've wiped out cystic acne after a couple of treatments. My wife said, hey, your son has your skin type. What are we going to do when he gets into his teenage years? I said, Botox. Couple rounds and I'm going to wipe it out. I'm not even worried about the scarring. So this is the cool thing is Botox manages active acne, pores, texture, tone, quality of skin. It provides profound skin healing. As you probably see, I can talk about this for 3 hours, but I'm not going to. I'm going to try to make this as concise as I humanly can. But there is profound healing to the skin, and that helps on the cause versus the effect. So I sort of divide this. Effect means here's a disease that manifests, and what a laser does is wipe down the effect, but it doesn't help the molecular damage of it coming out. The Botox helps the molecular level. The other reason why this is better than lasers is the neck and chest. You can't deeply laser this, or you're going to scar the patient, create problems. I used to try, it doesn't do it. This is an area that the molecular structures really Botox is so safe in the neck and chest. There's absolutely zero risk long term. That's the great thing. There's also a take-home message with this is not only is it durable and long-term and amazing and cumulatively stacked, but in your neck and chest area or in your face, there's no long-term risk. Laser, you can have scarring, you can have long-term problems with hyperpigmentation, hypopigmentation, problems with different things. This has none of those issues. Now, around the mouth, what are the limitations of it? Around the mouth, I'm a little more cautious because there could be more lip dysfunction. I've treated it with pores, texture, tone, but I try to confine my areas to the outer face. I do treat this area, I do nose, foreheads, etc. But the mouth area, I typically am a little bit more cautious because of temporary issues. So if you've got upper lip wrinkles, I'm going to do a dental block where you don't feel it, and I'm going to do those dynamic fillers. But I usually like to stay a little bit more lateral in those zones. And scarring, you said, does it help with scarring? Not deep scarring, but mild scarring, it can. They've actually done double-blind prospective randomized controlled studies in thyroid scars at a week, and the side that has Botox versus the side that has saline showed substantial improvement in 6 months, where it was very hard to see the scar on the Botox side. Are there supplements? So I told you alternatives, lasers are not a great alternative, but they can be a supplement in certain respects. But is there something on the level of a adjunct? To me, my adjunct is radiofrequency microneedle. It's a great treatment for improved molecular healing of the skin, deeper collagen restructuring. When do I not use RF microneedle? Is it in a darker skin patient? No, that's what's great about it. It bypasses the epidermis, and radiofrequency microneedle helps very much in all skin types. I do want to separate radiofrequency microneedle away from microneedle. Microneedle to me does very, 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 very little. Radiofrequency is necessary to tighten it. If you say, well, which would you choose, Dr. Lamb, radiofrequency microneedle or Botox? Well, radiofrequency microneedle also doesn't do anything with color pores too much, pores a little bit, but it helps tighten some of the deeper structures. I still think Botox wins any day over RF microneedle for the most part. Well, when do I use RF microneedle more? If I've got medium-sized acne scars, much better than what my Botox does. So you can listen to some of my videos on acne scars to understand that more in depth. Doesn't apply to most of you, so I won't go into too much detail. But basically, Botox works on the microscopic milieu and it helps to manage that causative problem with the skin, whereas microneedle works at sort of that medium depth problem. The one thing is, if someone's going to have a facelift, it does create a lot of deep scar tissue. I'm talking about the microneedle, not the Botox. And so I generally like to hold off on RF microneedle until someone's had the Botox, has had the lift or the facelift, if I'm planning that. Tons of more information I didn't get into. This is already an extensively long video, but I think this is a in-depth video that I would love for you to understand and watch before coming to see me, and hopefully understand the role, the limitations, the recovery, what's involved with meso or MicroBotox.